Okay, folks, we're in the last leg of the day. Hopefully you guys have enjoyed everything. I've learned a lot. Before we introduce our next speaker, I want to remind everybody to take some of the yard signs, which are out by the doors, before you leave today. And there's also some spay neuter packets, I think, from Pet Friendly Services. So I'm going to introduce our last session of this track. It's called Practical Strategies for Onboarding, Skill Tiering, and Retention in High Turnover Environments. Today we have Molly Myers, who is an emergency and critical care veterinarian technician, educator specializing in team training and life-saving protocols. She is an instructor in CPR and emergency response, and is active in several national veterinary organizations. Molly is passionate about advancing technician education and building strong, effective teams. I'd like to welcome Molly to the stage.
Unfortunately, I was really hoping I'm just loud enough as a human I wouldn't have to hold it, but I don't think that's the case. Help me, please, audio magician. Can people hear me? So I don't have to, thank God. I don't want to Sabrina Carpenter this mic because I'll probably drop it if I'm being real honest. Thank you for those who are hanging in for the end of the day. I know it has been a long, very interesting, very educational day, so I appreciate those who are sticking around for my talk. As my intro said, I'm an RVT, so I'm a registered veterinary technician here in the state of Indiana, and I have been for 15 years or so at this point. But I'm also a veterinary education technician specialist. So I spend all my time that I'm not supervising my ER, traveling, speaking, training teams, rescue organizations, shelters in primarily emergency and critical care, and staff training. So that's what we're going to focus on today. So having an effective technician training program really boils down to considerations of onboarding. That is when statistically most companies lose most employees, is when that onboarding process is disjointed. They don't feel like they're very welcomed when we're not super prepared for them and ready for them to kind of hit the ground running. Skill tiering, so we want to make sure that the right person is doing the right job on the right patient or pet. We want to retain those people. As you all know, rescue is and shelter environments are very high stress, so they are higher turnover environments. So we want to do everything we can when we have those excellent employees who have really shown dedication to the organization, that we keep those with us. They're also great ambassadors to get more people in. As somebody who's done hiring and interviewing for a long time in the Indianapolis area, when somebody's interviewing with a team and they say, oh yeah, the whole team's only been here for 6 months, but the building's been here for 15 years, makes everyone a little wary. Well, I don't know one want to work for you. Maybe I don't either. So the more we can retain those people, we have increased institutional knowledge, so better employees catch more things, take care of the pets better, and then we make sure that obviously we're providing the best, safe, healthy environment. So for a long time in veterinary medicine and shelter work and all of those things around animals, because we don't get all of the benefits of human medicine, a lot of our training was follow whoever is working today. This person's going to start on Monday. Susan happens to be here with them. They're going to follow Susan, even if Susan's maybe not the most comfortable training or the longest standing employee who has like the deepest depth of knowledge. We also haven't typically had a strong structure for it. I found this at my advanced care hospital. When I came on as a supervisor, we had a this person does it this way and this person does it this way. And while there are nuances for each section of work, the base should still be the same so that everybody has the same information. We obviously have high stress And I work in emergency medicine, shelter medicine. I worked in for a long time, as well as high volume, low cost care. So not spay neuter, but vaccines and other wellness care. And then again, we have high turnover. We don't want that person coming in hearing how stressful and how hard it is and how all of these people have quit. We really want to have to try to foster a positive environment to say, like, it's rough, but the work we do is important. The people here matter. This group is here to support you and to support our mission and what we're doing. So why does this matter? Well, for me, and for I'm sure most of you, patient safety is paramount. Obviously, we're all in this because we love animals, mostly more than people, but all love animals. And we want to make sure that we are being good stewards for them and taking care of them in the best way we possibly can. There is a reason that the person doing surgery is a veterinarian, because they have a lot of training and schooling in this. They are the best equipped to do it. So we want to make sure that we have the right person in charge of the right job for the right patient. You also get consistency of care. When you get more experience, you get very good at kind of going through your routine for the day, making sure that you hit all of the same points so that all of the patients get the same level of care. And whether that's as you move through the cattery or move through the kennels, having the same process to make sure that if something is off, we catch it pretty quickly. You also have increased team well-being. I know my team has voiced this in years past, as we have a lot of students who come through our hospital. They like having the consistency of the same people around. It lets you know your strength versus other people's strengths and be able to build off of those, versus constantly having to learn and go, oh, well, I didn't know this person doesn't like that or doesn't feel super confident in this, and having to constantly pivot. Where with the team you work with all the time, you know they're going to come in, they're going to do this, I'm going to do this, someone else is going to do this, and we're all going to kind of meet in the middle, and we can emphasize that. It's also significantly operationally efficient. We all hate to admit it, but part of this has to do with money. We need money to run our programs, help our clients, help our patients, help these pets. And the more time and money we have to spend in onboarding and training, and that high turnover drops that efficiency, because all of that does cost money and time. So if we have a consistent team that we're not having to constantly retrain, we save money in the long run. So in many shelters, statistically, what we see is reactive workflows. So instead of trying to maintain like that constant, we get, multiple people leave. Oh my God, we have to hire everyone with a pulse. Everyone with a pulse isn't the best idea. Some of those people filter out. Some of the good candidates stay in this kind of weird cycle. With that, you get a lot of skill variability. So again, not every person is created equal, even if they have the same education or similar backgrounds. Sometimes that still means they may be better at one thing than another. We're also running typically on limited staffing. I don't know anyone, I've never been to a shelter in my life that said, we don't need any volunteers, we're fine. I know in my hospital, I have never said, oh, we just have too much help today. It's so easy, never. So we're running on limited staffing, which means people are doing multiple jobs, trying to multitask, trying to keep up with everything. And we definitely have some emotional fatigue. When I have worked a long ER shift and I have euthanized 10 patients in a day because of various reasons, that's hard, regardless. I've been doing this for 15 years, it still sucks. And if it stops being hard, you probably need to leave, because it means that we're not being empathetic anymore. And that weighs on us. And when you go do that 40 hours a week or 50 hours a week, and then go volunteer at a shelter or a rescue and see that struggle again, it's hard, and we need to acknowledge that and allow for some space for that. Because what we don't want people to do is try to bottle it up because we're supposed to, and then break down later, instead of just acknowledging, like, this was really hard. This was a hard case or a sad outcome, and giving some space to kind of sit with that for a minute. So our goal is to work to convert that chaos into structure, having pre-made plans to kind of drop that cognitive load when you have these times where you go, oh no, we really need to hire 3 or 4 people. Do I have to make the training plan from scratch, or is it already done? And we can just start the hiring process and move forward. We want to take that burnout and emotional fatigue and try to turn it into growth. That is one of the biggest ways to help retain people. If they feel stagnant, like they're not learning anything, like they're not gaining anything, they tend to feel that burnout even more because it lowers their internal value, and turn that turnover into retention. We want to try to keep the people that we know are going to be long-term good investments for our organization or for our company. So onboarding, excuse me, we notice in so many ways that errors reduce with structure. It may seem second nature, a lot of the things you do, because it is ingrained for you, but there is a reason in human medicine. If they're going to amputate your right leg, they write on it, this is the one we're amputating. Not because the people in that room aren't smart or capable, but because mistakes happen. So we want as many checklists, pre-planned things, templates in place as we possibly can. And that confidence allows those outcomes to improve. When people come in and they feel like they can get a solid footing, they understand what the expectations are of them, of their role, of their position, what the organization's goals are, then they can feel confident in saying, hey, these are the skills I think I need to help. These are the skills I think I need to grow within, and this is what I can offer to you. So we're having a better collaboration. That first impression definitely matters. When you go into an organization that you want to work for, want to be a part of, and they're unprepared, and I don't know who you emailed, and that person's not here today, it doesn't leave a great taste. We all know mistakes happen. We try to be empathetic and understand humans are humans, but it doesn't feel like, oh, they really want me to be here if they don't even know who you're supposed to meet with. It also doesn't set a great expectation for the quality that we're expecting. If we want quality people that have their stuff together and are ready to jump in, we need to also be that. When we're the hiring facility or when you're looking for new volunteers, new board members, whatever it is, you need to have a structure in place for them. And again, that builds their confidence not just in what they're doing, but in your organization. And if you're not that organized, we all have steps, we all need to grow. Be upfront about it. Say, you're coming in on the ground floor. We need help with these processes so that people know that that's the expectation going in. I'm more than happy to help somebody build, but if they tell me it's built and it's just a pile of sticks on the ground, I now have concerns. Bad onboarding, I think we all know what that looks like, but in case you have been one of God's favorites and never had that happen to you, shadowing only, just that, hey, you're gonna follow so-and-so around and hopefully you'll figure out the gist of what they're doing based on that. No checklists, no idea what you're expected to learn. My hospital is, I think, one of the biggest in Indianapolis, but we have 9 departments, including an emergency room and an ICU ward. There's no way you can possibly understand all of what's happening with all of those departments and what we expect from you just by following someone around. You need very clear expectations to go, hey, week 1, this is what I expect you to know. Week 2, week 3. And people need feedback. We all think, from our perspective, statistically, that what I see is what you see, but typically it's not. There's nuances and experiences in there. The number of times I have had to talk to an employee about an issue, a problem, a area for growth, and I say, hey, I have to talk to you. We've had this error a couple times now. How can I help you? How can I train you? And they go, error? I didn't know I made an error. No one told me. We just kind of went around and fixed it on the back end, which is great. But if we don't go back to the source and say, hey, this is where I need you to change or improve, we're not going to see change or improvement. Most people don't know by osmosis what they don't know. So we have to be willing to give that feedback in a constructive and appropriate manner. Good onboarding is structured. We like to lay out at onset, this is roughly how long your onboarding is going to be. So it kind of gives somebody an understanding of, I have 2 weeks, 4 weeks, 6 weeks, whatever it is, to kind of understand the whole of this job. We want it to be measured. We don't want to take that whole 6 weeks and go, learn everything. Have a blast. We want to say, week 1, this is what I need. Week 2, this is what I need. Week 3, this is what I need. So that we have somewhere to meet, so we don't get to week 6 and go, oh, you actually missed a lot of week 2. Now we've had 4 weeks wasted that you've been doing this wrong. So we have to check in repeatedly, and they have to be supported in that. As much as we like to believe these things are intuitive, people need to be told. They need to have the direction and the psychological safety to say, I don't know how to do this. And that needs to be okay. So that you can go, oh, absolutely. Let me show you the resources, or let me show you how to do this. So that in the future they feel safe coming to you when there's a problem or they have a question, and they get the answer, not just you doing it for them. More and more we've seen success in the 30, 60, 90 model, which starts with observation. Especially us in animal medicine or animal welfare, I feel like we're helper people. We like to jump in, we want to do things, we don't just want to sit back and watch, but we have found over and over, it is actually beneficial. That first portion, even if you're doing this in an abridged, not a full 90-day onboard, that first portion of just take notes, ask questions, see if you can walk through the steps to go through an adoption. Can you go through these steps and know where all the pieces are before you're out on your own? That 30 to 60 days should be their supported practice. So in ICU, for example, those are the ones we start on the very stable patients and say, okay, you've proven to me you can do these things, but I don't want you to do this on a polytrauma hit by car that needs a bunch of things. We're going to start with a very safe post-knee surgery and see how that goes. They are practicing, not alone. So they still need somebody there, whether it's amoebaed and joined at the hip, or to check in with on like frequent multi-times a day basis to say, come to me with questions, but I'm going to let you get out of the nest a little bit. And then that last 60 to 90 days, we should be trialing them on their own. We should be taking the training wheels off, still supporting, but saying, okay, now I need to see you perform these tasks so I can say that you are good to go. So they go from observation to practice to performance. That way we're stacking it and it's not overwhelming. Learn, practice, perform should be your mantra for how these onboardings go. See it, do it, should be able to teach it. It's a very old mantra from Human Med, but we still use it a lot. Trainer roles provide a lot of consistency, and this is one of the biggest hurdles we've had in my field, is having people who are comfortable training, can provide consistent training, and enjoy it is a very hard trifecta. But if you get it, keep them with all but captivity, because they are so vital, because they make the biggest difference. If those training roles are consistent, so you know when new people come in, they're going to train them, they know all the steps, they have this down pat, versus, again, whoever's here. Because whoever's here may not be your best option. It also provides you with some accountability. So then if new employee 3 months down the line goes, well, no one ever told me that, it's going to be really hard to follow back up for 3 months of people and say, who didn't tell you this when they should have? This gives you a much more direct path, because that trainer should have checklists too to say, these are the things I need them to be able to do by the time they're done in their time with you. And it builds some mentorship in. I know we all love to think that we are approachable and friendly and no one would ever be scared of us, because like we love kittens and puppies and rescue and it's all happy. But truly, most people are a little frightened to have to come and say, hey, I don't know how to do this, or I feel overwhelmed, or I feel in over my head. So building that friend in with them to say, this is your buddy that's here to support you, may also help them kind of come out of the shell a little bit and get more comfortable saying, hey, I don't know how to do this, or can you please show me this again? Feedback loops are vital. We use them obviously all day, every day, but we have to be very intentional with these. Whether that's daily check-ins, weekly reviews, I can talk, I promise. Weekly reviews, or skill validation. If you come into my hospital and tell me I've been a technician for 20 years, I can do a blood transfusion, I go, that's really awesome. We're still doing the first one together. It's not that I don't believe you or I don't trust you or I think you're being dishonest. I want to make sure you can actually do it. I also want to talk to you about how you do it to our standard, which is not the same universal. We're very particular about how we do them. I want to know what you know, and then I want to show you what we need you to know for this. I schedule weekly check-ins with my new employees, and then like a bigger review every month for the first 3 months. The check-ins are pretty quick and informal. I'm not calling them down to an office and making it all scary. It's, hey, how's it going? I know you've been working with Susie. How is that? Do you feel like you've learned? What have you learned? Tell me something you learned this week. Tell me something you still don't know this week, so we can work on that for next week. And then that longer review at the end of the month is like, I want 3 things you've learned, 3 things you still want to learn or interest you, and anything for improvement that you see, because I'm happy to have that feedback too. Skill tiering defines growth and clarifies expectations. When you have high acuity patients, which means they can go south really quickly, all the way from like critical patients in the hospital to something like neonates, not everyone should start there, because not everyone has that skill set. So knowing when you come into a facility or when you come into an organization, this is the skill level we expect you to have, lets them know immediately what they need to improve on, what they are like, check, got it, don't need to worry about that, and what the next steps are. So it allows you to see growth, because growth isn't just, well, I've been here for 10 years. Have you been here for 10 years effectively? Or been here for 10 years because like it's routine? What have you learned in that time? And it clarifies your expectations. That lets those people know, I don't expect you to know how to do a blood transfusion to my hospital standards day 1, because that may be what you saw someone do when you're shadowing. Doesn't mean it's the same though. Doesn't mean that's where you're gonna start. So a very basic model of the tiers might look something like a tier 1 being restraint, basic care, TPR. Things you can teach most people to do on most patients, not all, most patients, pretty readily. Now, if I have a potential rabies exposure fractious cat, we're not starting there. We're starting on like the real chill ragdoll who's got gabapentin on board and is like staring at the dragons that we can't see. That's who you're gonna start with. But basic restraint, basic care, can you walk them, can you feed them, can you clean them? And TPR, while I know I see some medical professionals in the room that will have found heart murmurs and all sorts of crazy things. We're not talking about that. We're talking about basic TPR, at least somewhere to start. Easy skill to teach. Somebody has mastered those. You get reliable TPRs where the numbers are similar. No one gets bitten in the face when they restrain things. Then we can move up to something like venipuncture, actually drawing blood for testing. Medication administration, which is mostly going to be oral medication in shelter rescue, but sometimes it's going to be IV, especially with like high quality, high volume spay neuter. And those lab skills. Can they look at a fecal? Can they look at parasites? Can they do other ancillary things? And then your last one is going to be people running anesthesia, critical care, advanced procedures, having those more complicated client conversations or owner conversations. Obviously, that's not where somebody who has like just started in their career in animal welfare is going to go. So we want these high-level people to be in these positions for the best patient care, the best patient consistency, and the best outcomes. So we build from a foundation and move up. We can always expand skills. I am currently in the process of getting my specialty certification in emergency and critical care. That took a long time to get to that point. And I have to repeatedly tell like my wonderful, adorable students who are little ducklings, and they follow me around my hospital, when they see me doing an advanced procedure and they're like, oh, I want to do a thoracocentesis and stick a needle in a chest and do all of this. And I'm like, I have been working with this for 15 years. You can absolutely do that, not today. It's going to take time to build up to that. And that time doesn't immediately equal skill. That's why I said just because somebody comes in and says, hey, I have 20 years of experience, doesn't mean that they have 20 years of experience at the level we need them to be or with the skills we need them to have. So we have to validate those competencies. And that goes for every level, even when we have new doctors come in. Not that we don't trust them to doctor, but we have to teach them what like our flow and our standard is and make sure that that's consistent across the board. And retention. Retention, lack of retention, comes primarily from burnout. People are just exhausted. Animal welfare is exhausting. It just is. There's so many pets and we can't help them all, but we really want to help them all. And there's not enough people and there's not enough money, and it's very easy to get in this like negative cycle. It's also very easy to feel undervalued, especially with as passionate as we are, saying, I'm doing all of this stuff and we're still not making the progress I want, or I don't think my boss sees how hard I'm working. And then that lack of growth that we talked about, where I've been doing this for several years, but I don't feel like I'm moving anywhere. I come in, I do the same thing, but I don't feel like I'm better at it. I don't feel like I'm learning. I don't feel like I'm gaining anything. All feed directly into, I'm gonna go. And then we lose that institutional knowledge and that consistency of the team. We know these jobs are hard. People work hard jobs all the time though, but they work those hard jobs longer when they feel like they matter and they feel like they matter to the people around them. I'm sure everyone's heard that people don't quit jobs, they quit bad bosses. Bad coworkers too. If you don't make the people around you feel like you're happy that they're there, one day they won't be. So you really have to dig into that. Yeah, it's hard. We have cases that unfortunately we lose at our hospital despite all of our best efforts. And we have a little debrief and talk about it and say, this really sucks. Like, people are allowed to cry, people are allowed to have feelings, not in front of the owners. We don't want to interrupt their grief, but let's talk about this. Let's talk about what we could do better. Let's talk about moving forward, but let's acknowledge that this sucks. We didn't want to lose this pet, but sometimes the best medicine is not stronger than the disease process. We did our best, and it wasn't enough this time. But most of the time it is. We do actually help a lot. We do actually save a lot. Let's talk about how we can save the next one like this, or could we? Sometimes we just have to acknowledge the disease was overwhelming. If you are a 25-year-old cat with kidney disease, I can't love you better. Your kidneys don't work no more. But we can talk about keeping them comfortable, keeping them happy, interactive things, cat-friendly things, low-stress handling, so we can divert that from just this sad spiral to what can we do differently. So you have to have some growth paths. As an employee, you don't want to be the one trying to figure out what your manager wants to see with the next level. You need to know what that path is, to know if it's achievable for you and what they expect. You want to recognize when people do good work. And sometimes that's a shout out. Sometimes it's a raise. I'm always fine with a raise. If anyone knows anyone in the higher ups at VCA, you can vouch for me, that's fine. But even saying we have a Teams online channel at work, and I'm saying like, hey, thank you so much for picking up that shift. Thank you so much for dealing with that difficult client. Like, I really appreciate that you took that on. Those little things, even coming from your team, make a big difference. Just saying, I'm glad you're here. I'm happy you were here today. This shift was rough, but we got through it, and you were part of us getting through it, so I'm happy you're here. Supporting one another, supporting our mission. Sometimes we have to go back to that statement because we want to do all of the things, and we can get a little blindsided by wanting to do all of it and have to go, okay, what is our mission statement though? What is our honing factor? To what lens are we holding this up against to say, does this fit with what we're trying to do? You want to make sure that you have a psychologically safe environment, especially as we finally get more comfortable talking about mental health and well-being in veterinary medicine and animal welfare. It needs to be safe to ask questions. It needs to be safe to be wrong or to fail. And it needs to be safe to learn. The worst thing for a hospital like mine is when people won't say, I don't know. The likelihood you're gonna hurt someone else or a patient is so much higher when you can't say, I don't know. So we put a whole program in place where you can report issues, problems, whatever. We made a contest for a raffle. If you find a mistake, your name gets entered in a raffle for a prize. Not to call out mistakes, but because we wanted to make it say, no, it really is safe to say I did this wrong. No one's gonna pull you in an office and write you up and fire you, and unless you do something real cray, so never say never. But saying, oh my gosh, this said a half a tablet and I gave a whole tablet. I don't want anyone in a panic spiral. I want them to feel like they can come to the doctor, come to me, say, hey, I did this. How do we fix it? Move on from there. Because if people don't feel safe in those three areas, they're not going to hang around. Your culture matters. Again, supportive teams stay, toxic teams leave. And it's not just the boss. I don't care if it's the top producing, best whatever in your organization. If they are an awful human to work with, your team is going to have issues. That has to be a consideration. Cancer spreads. So if somebody is making that team really toxic, you have to correct that because they may be the only pillar left standing eventually. Celebrate small wins. This is, I'm not above making some like real goofy classroom style like employee of the day. We just made one that's like a learning leadership board. So the more CEs you attend, you accumulate points. And that is like out in the middle of our hallway where everyone can see it. We post in our internal and external communication channels like, woohoo, somebody just got their RVT. They became licensed. They did their first epidural successfully. So that they see that recognition that we see them. We see the work that you're doing and that you're trying. And even if they're not to the achieved, you can still celebrate progress. Because almost everything is a stepwise motion. You can't do this until you go through all of these steps to get there. So we're going to celebrate those steps. That celebration might not be as big, but we're going to celebrate it. My new students get celebrated when they finish externship, when they graduate, when they get their technician license. I buy a lot of cupcakes, like a lot. But you know what? Most of our students stay working for us because they feel like the team is invested in them succeeding, and they're so excited to celebrate that with them. So when we look more at shelter med specifically, you're usually fighting against low staffing because of budget limitations. We all know, I don't know any shelter again who's like, we have all the money we need. Don't donate. And a high demand. Shelters are overcrowded. People are fostering 57 dogs, doing all this crazy stuff, trying to take care of all these babies. So they have an especially hard road trying to maintain and keep that consistency of care. So there's likely going to be a lot of cross-training so that people can do multiple things. You just want to make sure that they still have the structure of both sides of the cross-train. So if I have someone who is not progressing as quickly as we would like as a veterinary assistant, I'm not going to have them start learning CSR skills because we haven't hit the foundation here, so I'm not going to add another foundation for you to learn. But I want to make sure if by the time we're done, you're like, I want to be able to flip-flop back and forth, that you can do both, that you hit all of those points so that you are proficient in both before we start having you cross over. And you want to prioritize those skills. It may be something where you say, I would really love for all of our veterinary assistants to be able to draw blood for a heartworm test. But if you are heavy in kitten season, that may not be the skill to focus on right then. Not that you can't do it ever, but you need to make sure it makes the most sense operationally. Your vet partnerships will help you significantly, and if you ever have issues finding veterinarians to partner with, reach out to your state board. I bet they can help you. Not just because I'm on it. I can tell you we will. We have helped develop so many protocols for shelter rescue organizations to just help streamline the process, what every pet coming in should have, what that exam looks like, how long we can hold them before they have an exam, all of those things. If you have a partnership with a veterinarian, they can make that so much easier. Or having a tech on staff, even if it's like locum staff. I've done that for a few rescues in my time, where they called me primarily when they had big intakes or issues we needed to solve from a medical standpoint. And then we could rope in their doctor and say, hey, this is what I think. Do you approve this plan and move forward? And it took a lot of that cognitive load off of the shelter that's trying to do 57 other things. Communication with them is key. I don't know, my referral coordinator and I probably have 50 rescues in the state that have one of our cell phone numbers, that even at my hospital, which hopefully none of you ever need to bring a pet to because it's not for normal things. It's only emergency and specialty. They just backdoor in. They call us and say, hey, what can we do with this? What kind of discount can we get? What can we get set up? And we're happy to help. Or say, I'm happy to see you, but you don't need my surgeon for this. You could do this at your primary. Because we're here 24/7, so they can always get a hold of someone at my hospital. So we're happy to answer those questions and have those open lines of communication, which will help you significantly. And we're going to talk just a little bit about money, because we know it matters when it comes to animal welfare. Because again, ain't nobody have enough. So when we look at your ROI, or your return on investment, and your time saving, especially when you're at high quality, high volume, whether that's spay, neuter, or wellness, your techs free up your DVMs a lot. DVMs are usually the most expensive person to have there, and the most we can maximize their time, the better for you. So as much as techs can do on the front and back end is more cases that your doctor can see per day. So if they can handle a lot of the client interaction, paperwork signing, pre-anesthetic workups, all of that frees the doctor to see another pet. So you can get more through the door with investment in high quality skilled technicians. More patients seen means more money if you're high volume, but it also means more pets helped. Whether you're in a financial, like, revenue generating institution or not, we're all here to help more pets. And having technicians on staff will absolutely do that. It also improves efficiency because we do all of the things. We can usually help identify time-sucking pitfalls and say, hey, we have them sign forms like 3 different times. Can we just combine all of that? Can we do this? Can we do that? You can really get some good problem solving out of them because we do all the things. Veterinary technicians are multifaceted, so we can usually help find pitfalls for time management, for, hey, if we have one more person who can start recovering this patient, then I can start dropping the next patient and we can move through these surgeries faster in the day. So you see more patients and get through things faster. When you have those high quality people that you're having that investment in to keep them there, your errors go down. You also have lower turnover costs because hiring, training are expensive, especially if they're done well. So we don't want to have to do it over and over and over again. We want to be able to keep the same team and keep those turnover costs low. For example, statistically, this is in general practice, but adding 1 licensed technician adds 3 to 5 cases per day per doctor, which is a significant amount over time. So if you can get those skilled people in so that you're making more progress through your day, getting through more things, you're helping more pets, you're making more money, and it increases that revenue potential overall. Not to mention the extra skills like toenail trimmings and microchips and like other things that don't require a doctor that technicians and assistants can add to your practice or to your facility. So let's say on a low end, 3 additional cases that maybe bring in $100, because that's easy math, and math is not my strong suit. 300 a day, 75,000 extra per year that just 1 technician can bring in if they're utilized and utilized appropriately. Those turnover costs are a little bit hidden. We don't see them in the same way we see other costs, but hiring is costly, whether that's just time, paperwork, interviewing, depending on your facility, background checks, drug screening, all of those things cost. So having to do that over and over again. Training cost is also fairly expensive. If I am training somebody, you're not just paying my salary to be there and work, but you're paying another person's salary who is not generating as much revenue. So that training gets expensive and you're way less productive. If I can get through 15 cases in a day with my doctor. When I'm training someone, I can usually only get through 10 because you have to slow down and explain and go through those steps. So if I have to do that for half of my shifts, that's a lot of cases that we're not getting to see. And if I have to do that continually, now we've just dropped our revenue potential significantly. So that retention goes directly to savings. You keep your staff longer, you reduce rehiring, having to constantly refill positions, you lose that loss of revenue. Technicians are a force multiplier. Like I said, one very skilled, very talented doctor is going to get things tasked to them that don't have to be. Leverage those people so that your doctor gets the most patient contact time. It improves care because if only one person in the room knows what to do when something goes wrong, you're going to have chaos, which is not fun for anyone. And it supports your team. It shows that you value them. It shows that they matter, that you're happy they're there. So this is just an example. I know it's real small. Don't try to read it. It'll hurt your eyeballs. But implementation, step one is getting checklists in order. Every checklist, every template, everything that can be pre-made that you can just edit saves you so much time later. Step two is that implementation that you want to do staggered. Do you know how to do it? Knows how, shows how, and then does it. So that we're not starting it, does it, going, why don't you know these foundational steps? Trainers should be assigned intentionally, and they should have these things. They should obviously be competent in what they're training. They need to be able to effectively communicate. They need some emotional intelligence to go, I think this person's overwhelmed. Maybe I need to slow down a little bit. Or like, ooh, they're catching up and they're bored. We need to speed this along. They need to be consistent. They need to have an attitude that you're happy being presented out to the world. And they need to be comfortable teaching. I have several technicians who are very highly skilled that I trust with my dog's life. They don't want to teach. They're not comfortable with it. I don't put people with them, at least not long term, because I know it's not their forte. They help do training in other ways. Maybe they don't want a person with them, but they want to make one of those checklists. Excellent. Now I just have to edit it. I don't have to make it from scratch. That feedback loop is incredibly important. People need to know where their improvement needs to be, what you're expecting of them, if they're meeting those expectations or not. So your big picture should be structure creates stability. There's lots of things in animal welfare we cannot control. People are crazy. Animals do whatever they want about half the time. There's not a lot of it we can control, but everything we can control should be structured, preset, so that when the chaos hits, this also isn't chaotic. And it can look a lot of different ways. Stable for one organization, like a good structure, doesn't mean it's going to translate to the next one. So don't be hung up on saying, well, my checklists don't look like theirs, my process doesn't look like theirs. It just needs to be stable and consistent for you. Final thought, as always, training builds teams that stay. When people know what the expectation is, know how to be considered successful, know what is expected of them on the day-to-day, they are much more willing to invest in an organization and stay with that organization. Question time. I'm scared to remove the mic. Ooh, okay. Are there questions before I start walking around like a fool? Okay. Oh, that was terrible. I'm sorry, it committed a hate crime and I wasn't prepared.
In attracting staff, qualified licensed staff to come work at the clinic. We have struggled as a nonprofit to keep up with full service wages paid to RVTs. Do you have thoughts on, I mean, yes, we can raise the wage, but sometimes it's also a matter of skilled staff wanting to do more than what we do at a spay, neuter, and wellness clinic. So I'm just trying to rethink ways that we attract that kind of talent.
Yeah, absolutely. One of the big things we tried to do was leverage non-credentialed where we could. Not that credentialed techs aren't important, and we want them, obviously, but my tech who's in the middle of doing a dialysis treatment doesn't have to be the one to go walk a dog. So we have a team that is centered on technicians, but we have lots of very talented assistants who can work circles around us part of the time, and we leverage them as much as we can. So if there are things that have to be a technician, which Indiana's kind of loosey-goosey about, obviously that, but we leverage as much for assistance as we possibly can so that we can really focus and say, do we need the tech to be here for 10 hours? Or could we have assistants help and we get them down to 8 hours, but I can pay them more for that shorter amount of time? Anyone else? Okay.
I just had a quick question about your mistake raffle. How well did that go over? And did that, like, facilitate learning and improvement within the team?
Yeah, absolutely. My boss and I are both a little crazy. So it worked really well because what we were finding was they're called halos at my hospital. We had reports from the same 3 or 4 people, not like consistently like the person is making the mistake, but the same person was catching the mistake. And we looked at that and went, okay, it's not like they're catching thousands or anything scary, but if this is the only person who's really deep diving, what are we missing? So in adding that raffle, it had people who normally maybe wouldn't have submitted one, start submitting them. And going, oh yeah, I noticed that this was wrong, but I just fixed it. I didn't report it before. So they were just errors we weren't seeing, so we couldn't add into our data at that point. But we had, significant is hard to say because it's going from like 1 error to 3 in a week, but like we did see improvement in that people felt comfortable to say, hey, I caught something. And then we could have in our like team meetings, we would discuss it and say, hey, we had 2 medication errors last week where the dose was wrong. Sometimes doctors can't math either. Please double check it. Anyone else? Yeah. Yeah, I like your sweater, by the way.
Thank you. You mentioned like negative, or people leave negative coworkers as well as bad bosses. So if you have really strong employees, but they have a negative attitude, is there a way to talk to them? Because we have really strong employees, but then they have a hard time working with other people. So how do we encourage them to keep strong, but to be a better coworker? Does that make sense?
Yeah.
Because I don't want to lose these people, but they're also, everybody's coming to me to complain, and I'm like, I can't do my job without these people because they're so important to us, but they're difficult to work with.
It's hard and it's the unfun answer, but I have to have, when I've had mine, I have real conversations with them. And I'm very blunt about it. Not to be hurtful, but to say like, I need to meet with you, come in. I'm gonna have to give you some hard feedback. This is what people say who have to work with you. That can't work for us. Because as much as I want you on this team, you can't work alone. You need people with you. So here are the ways I'm gonna help you, and whether that's I'm gonna check in with you weekly, I'm gonna bring these concerns straight to you. I am gonna I've given people passes for courses on empathy and teamwork, or said, hey, we're going to read this book together, and that's going to be part of our check-in every 2 weeks is, did you read this chapter on teamwork? And see how maybe some of your interactions could have been a little different. If they're not willing to make those changes, they can't stay. Because I can find somebody else to do the work that won't hurt my team. But that's never my jump. My boss, my HR boss, a long time told me, no one gets fired, they fire themselves. Because we give them so many opportunities. Unless, like I said, they do something cray, like complete on the newsworthy cray. We've had this conversation. So by the time we get to the point of like, I've coached you, I've given you resources, I've offered change, we've done all of this, and you still can't meet the minimum of a respectful workplace, I can't have it. And you'll see that those people under them tend to step up because now they feel protected too. And they feel that loyalty back to go, I can come to some place I love and I don't have to feel bad about it at the end of the day. Yeah, of course. It's not easy. It's not. Letting go of some of my top texts hurt, but luckily most of the time we can turn it around. Because they usually don't realize it. I don't think most people come to work every day and go, I want to see how many people I can make cry. Even if that's what it seems like they're doing, I don't think that's actually their intention. So once they realize like, oh, I'm like actually affecting and hurting other people, usually we can find a way around it. Even if it's like, yeah, maybe we don't put trainees with you because you're a little, tiny Chihuahua land shark. But we have you do other things like give a lecture so no one has to be real close to you. That's a thing. We can find an alternative. Anyone else? Marco? Cool.
Thank you.
Yeah.
All right, so just a couple of things. Once again, there is a sticker under one of the chairs at every table, and whoever has the sticker under their chair gets the centerpiece, so that's fun. Also, I'm going to remind you one more time to complete your evaluation, and I think it speaks really well to the quality and quantity of this conference of how many people are still here at the end of the day. So thank you so much for staying around, and we'll see you next year. Oh, there's a box out in the lobby for the evaluations.